dentists, and I am very pleased to welcome Brian Whittle MSP in to chat with us today. Now we're looking at talking about prevention. Prevention is a massive thing in dentistry. In Scotland, we're starting to get it right with programmes like Child Smile. However, there was a recent letter in the Daily Telegraph talking about the issues in England about prevention, hoping to try and mimic or have something similar to Child Smile down south. I think we still have a lot to learn, and I thought it would be great just to very quickly pick your brains on a few things that we could be doing better. Prevention in general in our health out here in Scotland and across the UK, but in particular in dentistry. So tell me a little bit about your role, first of all, within Parliament.
Well, I sit in the Health and Sport Committee, and as one of the committees I sit on, and I'm also spokesman in Health, Education, Lifestyle and Sport. But one of the big things, the reason I got involved, quite frankly, in politics was on the preventable health agenda, something that I have been very passionate about for a number of decades, to be quite honest. And that's the direction of travel I'm trying to push the whole of the health agenda. We did a study in the Health and Sport Committee, and the cost of the preventable health agenda to Scotland came out at something in the region of £30 billion. So that's not just in terms of medical treatment, that's in terms of loss to business, absenteeism, productivity and whatnot. So £30 billion is rather a lot, and just to put that in context, I think the overall Scottish budget is 34 billion. So if we could tackle even 10% of the preventable health agenda and take that £3 billion and leave that within the health, in the NHS and in general health, what a huge impact that could make. And I think that's the direction of travel we have to go in, because the current trajectory we're on with this is unsustainable. And I would suggest to you that the government currently is not managing the sustainability of the health service. We're managing its demise. We cannot continually. We can never find enough money to put in the health service. That's the reality. And we need to continue to look at ways of getting more money into the health service. That shouldn't change. But what we do need to look at is how we prevent those conditions from happening in the first place. Now, there's lots of them, of which dentistry is one of them. It's a big one, actually. But obesity and diabetes and musculoskeletal conditions and 40% of cancers are preventable. So there's a lot in there. And oral hygiene is something that when I bring that up in Parliament, people look at me in that sort of quizzical way. And I'm thinking, wait a minute. There was something like a 10% rise in child tooth extractions in a 4-year period. So it's a major issue, and the health of your mouth and oral hygiene has such a massive impact on your overall health, including mental health. This smile that we have and having good oral health has a massive impact on your overall well-being.
It does, and it's not just aesthetic. It's obviously if you have a problem aesthetically, that has a massive impact on relationships, on getting a job, self-confidence. But also if you're in pain, if you're constantly in pain, that's going to affect your mental health. And if you're not able to eat food, you end up eating unhealthily or not eating enough, and that also has a massive impact.
Or eating through a straw.
Yeah.
But absolutely. I don't have particularly good teeth. It's probably the thing about me that's the most unhealthy. I've been trying really hard to look after my teeth. I'm trying really hard to look at what I eat. I have changed away from certain foods because of the consistency of them, quite frankly. And I know from personal experience how demotivating and how poor sometimes it makes me feel in terms of my overall health. So it's massively important, and the preventable health agenda is a long-term agenda. I mean, I know you don't believe this, but I'm 54 years old. Where we need to work is 50 years ago.
Yeah, absolutely. Absolutely.
The preventable health agenda is not a short agenda, which is where politically it becomes a problem, because we work in such short cycles, 4 or 5 year cycles, and the preventable health agenda is decades, and that's how we have to change the way we think about that. And in terms of oral health, it is becoming increasingly a problem, I think, and you know, if we it's something that we can tackle, and I think we need to look politically. We need to look at it. I think the medical profession itself has to start looking at that. You know, you guys are lost in this sea of busyness, for want of a better expression. You have, you know, next patient. You're almost firefighting, where there's no room or manoeuvre to start looking at how do we prevent people getting into this situation in the first place. And the people I worry most about are the people you don't see. You know, where this is the biggest impact is that area, that lower 20 percentile, who are less likely to turn up at your door. You know, there are people out here who don't own a toothbrush, who don't, you know, the kids don't have a toothbrush, they don't have toothpaste. That's where we've got to work. Because at the end of the day, by the time they get to you, it's a mess.
It's too late. Again, that's one of the great things the Child Smile programme's been doing in here in Scotland, in providing toothpaste, toothbrushes to kids at nursery schools, and that should be a nationwide project.
Without question. I think one of the things I often get thrown about, you know, how are you going to afford that? Well, actually, how are you not going to afford that? It's the preventable health agenda. Is if you invest in that arena, it means that we're not taking. You know, the problem with the preventable health agenda, it's not like we're going to save all this money in the health and we'll get all this money back, because we're not. What's going to happen is the money that we save will remain within the health service, but it will be targeted in different ways. But the roll-on impact of that is a healthier nation.
Absolutely.
And if we're a healthier nation, our productivity goes up, our attainment goes up, you know, our confidence goes up, our resilience goes up, all those things that have a positive impact on finances of the nation. But it's such an ethereal concept, you know, on a day-to-day basis, it's quite hard to grasp. So, Child Smile programme, without question, is a fantastic programme, and I would like to see that enhanced more, rolled out more, you know, in all sorts of arenas.
Absolutely. And again, I think the thing a lot of people don't fully appreciate, I mean, obviously if a child has, at the age of 2, 3, 4 years old, has a tooth with decay, they end up seeing their dentist. The kid is either anxious or not mature enough to be able to understand, if I sit and tolerate this slightly uncomfortable thing for 10 minutes, the tooth's fixed. So a lot of these kids end up being referred to hospital for general anaesthetics. It's the number one cause of hospital referrals for kids. You know, general anaesthetics obviously come with risk. You know, they're very, very safe, but there is always an element of risk with a general anaesthetic. And also the thing that parents often have issues with is the kids get one tooth that's painful, but during the general anaesthetic, they will remove any tooth that has even the slightest bit of decay in it. And the thinking behind that is they don't want to see the kid again in 6 months because that one's now developed into an abscess. So a lot of the parents I end up seeing come in and say, can you help save these teeth because we've been told we need 12 teeth taken out. And it's very, very difficult at that point. That then has a snowball effect, because if the child has, 12 teeth taken out, they're then going to be in a position where they're far more likely to need orthodontic work, because your baby teeth hold the position for the adult teeth coming through. And if the adult teeth come through and they're crowded, they then are more vulnerable to decay. You need to have braces, and it rolls on and on and on. When the simple fact is, if you bring it all the way back to when that kid is 2 or 3 years old, reducing the frequency of the sugar and brushing the teeth is going to solve all of those issues and prevent them from happening in the first place.
I think that we have this increasing problem in our society, and we have to change the conversation. We have to change the language that we use. I've said before that there's only 3 things in health, and it's nutrition, as you've just mentioned, is a huge factor. Physical activity and inclusivity. Those are the 3 pillars that we need to build, all our health programs on. And in terms of, getting out into that and that environment where they're included in a much bigger society. They learn through that society. We're eating better. We're reducing the sugar that we're taking in. We're brushing teeth. And that, I think we talk about this, and you probably impact a big part of society, but you'll impact a big part of society that's already plugged into getting healthier. The society that we're not plugging into at the moment, and I think this is where we're driving inequality, are those that are being left behind. And those are the people. If you want to increase our attainment and productivity, if you want to tackle that in schools, if you want to tackle numeracy and literacy and all that kind of stuff, that's where all this is relevant. We have to look at ways in which we can impact at that level. Those who that have the least in society, those who are being left behind, and we all have a responsibility to that. We have a responsibility as politicians. You guys have a responsibility as medical professionals to start to consider how we tackle that. Now, I say our responsibility would be to give you an environment in which you're allowed to do that. I think that's where politicians and where government come into that strategy, to give you the time to do what you're professionally able to do. But you guys have also got to be part of that process. And there's two. It's not just There's not just a one-way street. We're pushing back against each other here. We're asking you to do more. You're pushing back at us to say, okay, give us an environment in which we can do more. And look at that preventable health agenda, because ultimately, it won't reduce the number of people that you see. It's not like if we have the preventable health agenda, we'll have nobody to fix. Yes, you will. You'll just be able to see people quicker, and you'll be able to deal with things earlier. So we have a much healthier ongoing situation. See, 54 years old. The time to deal with my teeth was 50 years ago. And so it is that long-term agenda we need to look at.
But that's true, and that's long-term, but also in the history of society, that time will come, remarkably quickly. But to affect that change in the 21st century, we have to be doing it now, because if we do nothing now, it's going to be exactly the same in 2050.
It's not going to be exactly the same. It's going to be much worse. We are on a trajectory on the preventative health agenda. We're on a trajectory. The rise in type 2 diabetes, which now takes up over 10% of the NHS budget, is incredible. Obesity, it's about £4.5 billion. The cost in real terms to the Scottish economy. And the rise in cancers, the rise in the musculoskeletal conditions, which is associated with diabetes and obesity. That trajectory we're on, the rise in poor oral hygiene, we're on that trajectory at the moment. So, if we do nothing now in 2050, well, it'll not be worse. I think in 2050, we might be in a situation where we don't have an NHS. We have a completely different system, and we always talk about the NHS as the real public service, the pinnacle of public service, it's most precious to us. But we're not doing it. If we don't do something about it now, then that'll be gone. And by the way, as individuals, we might look at that system and go, how can I possibly affect that huge big system? Well, as individuals, we can. And it takes that. We talked about peer groups. Why are we not in a peer group talking about how can we deliver? How can we tackle that element of society that we don't see, that are not coming to dentists? How do we tackle that? How can we change that environment?
And just get the information and the education across. Again, what I guess one of the biggest surprising things that I hear on a scarily regular basis is the parent of a 2 or 3 year old saying to the kid, "I told you should brush your teeth." And you think, wow, you don't tell a 2 year old to brush their teeth. You stand and you brush the 2 year old's teeth.
Absolutely. I think, and we've all got kids. I mean, my youngest, my 10-year-old, I'm like, she's in their bed, have you brushed your teeth? Yeah, I'm going to come out. Okay, I haven't. you have to be on it all the time because children don't look, they're indestructible. Mm-hmm. Children don't look 10, 15, 20 years down the line. Mm-hmm. I'm too tired. Drag her out of bed and get her into and brush your teeth. Yeah. We've got to get that education across. That it's all very well saying personal responsibility, mm-hmm. and personal responsibility plays a huge part. But we've got to make sure that people are educated to understand that, to be able to make those positive decisions. We've got to make sure they have the tools to do that. And by that I mean there's a section of society out there who don't own toothbrushes. Mm-hmm. Who knew? Mm-hmm. You probably did. I'm learning that. Mm-hmm. I don't have toothpaste. One of the things that if you go to your local food bank, they were asking me for toothpaste and toothbrushes. Mm-hmm. I never thought of that. Mm-hmm. Which is why I'm asking dentists to consider if they have access to toothbrush, toothpaste, consider where they're going, and maybe now and again pop down mm-hmm. to the food bank and hand them in, because that, if you do nothing else, mm-hmm. that has a huge impact.
Absolutely. Something we do actually in our clinic. We'll quite often give them to missions and homeless shelters as well, on the understanding that some of the folk using those facilities or using that toothbrush may not have the ability to even hang on to the one they used that once, but at least they've used it.
I mean, it's an impact, and it's a small impact, but little ripples in a pond. Yeah. If that's all you do in the preventable health agenda is consider now and again popping down to a food bank to hand in a small bag of toothpaste and toothbrushes. Yeah. If that's all you do, but if every dentist did that, that'd be huge.
Exactly. You've suddenly, as you say, that 20% are going to have toothbrushes.
Correct. Absolutely. We then give them the opportunity. Yeah. It's access to opportunity. So, I think, and there is an education system around that as well. But that ability for kids to brush their teeth on a regular basis, mm-hmm. we take it. We just assume that happens, mm-hmm. and if you've neglected your children. No, mm-hmm. There are people out there who don't have that same. We just assume they have that opportunity. They don't
have the understanding and the opportunity.
Correct. I think it's. I mean, I've got this phraseology. It's government's responsibility to create an environment where opportunity is available to all, irrespective of background or personal circumstance. There's an addendum to that, in that we have to make sure that everybody understands the opportunities they have and have the confidence to take those opportunities. So that's the next bit on that. Maybe there's something else we can do on top of just making sure that everybody has access to good oral health, the toothbrush and the toothpaste. Maybe there's something else we can do around that, but around the education programme. But bottom line is, dentists, if nothing else, if you do nothing else in this agenda, that's something you could do that would take very little effort, could make a huge impact in people's lives.
And I think that doesn't mean that the conversation can't continue with the health departments and with NHS England about setting up official government-led policies and ways to do this, especially in England. As you say, I think we need to continue and grow what we're doing here in Scotland, but certainly south of the border, I think that's is going to be a huge thing. As I say, this the letter that went to the Telegraph, and it's almost a yearly thing that goes in now, just highlighting why do they not have a similar programme in England to help set this up. So, as you say, in the meantime, let's have a think about what else as a profession we can be doing while that policy is taken forward.
I think it is important. At the end of the day, I think it should be government led, but I think in terms of the structure, but what actually happens on the ground has got to be the healthcare professionals. You're the people who have trained for years and years and years to do what you do. Who am I to tell you how to deliver good oral health? But it is our responsibility, I think, a government's responsibility to create that environment that allows that to happen. And those sort of programmes, that Child Smile programme, it's been hugely successful up here. Down south, put pressure on, because it is making an impact. We need to put pressure on down south in England and Wales to make these kind of good ideas happen down there as well. That shared, good practice needs to happen.
Okay, well, listen, thank you very much for having that conversation, and I think off camera we'll probably continue that discussion, and let's see what we can do together and work out.
Okay, thank you very much.
Thank you very much for coming in. Cheers. Again.